Dehydration and back pain. Does dehydration cause or contribute to back pain?
Yes, it can. Very much so.
And if it can, from a position of a massage therapist, how do you see that as your client presents?
Well, sometimes it's the cause of mid-back pain because your kidneys are right there. So even though I'm massaging the muscles, I'm not going to solve that back pain because the kidneys are having trouble.
All right. So just so we can be clear, where is the mid-back? Can you show that to us? Maybe even, here, let me scoot out of the way a little bit and show it to us with Dr. Jamie here.
So you get it right through here. In that, if it isn't muscular, which sometimes it's not, it's because your kidneys.
So you have a kidney then that is right here, and another one that's right here. And so that if you're getting that kind of signal from that, then the situation is you might want to evaluate your dehydration. Is it always easy to tell when, if you're having back pain, that it's due to dehydration?
It depends on where you are of your body.
Okay. And from a doctor's standpoint, if somebody comes in with back pain, how do you determine that back pain is from dehydration?
Well, with anything in medicine, you do like a good history, you ask questions and then you do a physical. But I do have I'm going to turn the table, so I'm going to ask you a question. So does like a herniated disc or a compressed disc, does that cause back pain?
Well, typically, but most of them, like a herniated disc that I've seen anyway, tend to be, go ahead and turn again, tend to be down here on the lower back pain area rather than in the mid when we're dealing with herniated disc. Can that cause back pain though? Absolutely. What do you think, Irene?
Yes, it can cause pain.
Mm-hmm. And did you have any thought there that you were building for as it related to herniated disc and whatnot?
Yes. And so actually, if your body is low on water, the water also helps to make that lubrication and for that joint and in between each of your vertebrae. So your spine is made up of a bunch of different bones, as well as the spaces in between the bones, which would have fluid as well as cartilage. And so the water goes in there as well to kind of buffer all that tissue and as a lubrication. And so if you're low on water, you don't have that lubrication anymore, and your bones will start to come down on itself and compress, and that causes a lot of pain. It's not necessarily midsection though, but
it's still the same thing. But can you have? I mean, you can have a disc that's out in this area.
The vertebrae goes out. The vertebrae goes out, not the disc.
Okay. So as that goes out, then what I think I hear you saying is that a contributing factor can be a dehydrated condition. Am I correct? Okay. All right. So as it relates to dehydration and back pain, and yeah, we're not talking about necessarily mid back here. We're just talking about the full back. What about can you have a situation where you have trouble up here in your back and whatnot in your spine because of dehydration? Is that possible?
Yeah. Okay. You bet.
Okay. And doctor?
Yes.
Okay. And would that then cause us to exhibit such things as headaches and such like that, which really are stemming from the back, which really is stemming from dehydration, which really is stemming from lifestyle choices? Am I correct in what I'm saying?
Yes.
Okay. Any other thoughts as it relates to dehydration and back pain? All right. We'll see you in our next video.